If you're over Altmish, it might surprise you to learn that the very vegetables you trust to protect your heart may quietly be placing it at risk. That's right, not just greasy takeout or salty snacks. But even the fresh produce sitting in your fridge could be contributing to heart complications you won't even notice until it's too late. I've spent decades treating older adults for heart issues. And again, I see well-meaning people unknowingly undermining their own health with foods they believed were helping. Some of these vegetables conflict with essential medications. Others can shift your blood pressure, trigger irregular heart rhythms, or harbor bacteria. Your immune system is no longer strong enough to handle. Worst of all, many of the warning signs stay hidden until damage is already done. In this conversation, I want to walk you through 9 common vegetables that could pose real danger to your heart, not to scare you, but to empower you. These risks can be managed if you understand what to look for, and the first food I'll discuss, it might already be on your plate today. Before we begin, if you haven't subscribed yet, go ahead and click that button and turn on the bell so you never miss another tip designed for your health. If this video helps you, type 1 in the comments. If not, type 0, so I know how to better support you. Let's begin with our first vegetable. 1. Spinach. When medications lose their protective power, on the surface, spinach appears to be the perfect health food. It's green, natural, packed with vitamins, and for years, we've been told it's one of the healthiest choices we can make. And while it can be a great addition for many people, for older adults, especially those prescribed blood thinners, spinach might quietly be undoing the very treatments keeping them safe. Let me tell you about George, a 72-year-old retired school principal who had been doing everything right. He cut out junk food, exercised daily, and started drinking smoothies made with spinach and kale. But he came into my office one day feeling tired, confused, and unsure why his progress had stalled. George had been prescribed warfarin, a medication that reduces the risk of stroke by thinning the blood. What he didn't know is that spinach is packed with vitamin K, a nutrient that promotes blood clotting. The two do not mix well. Eating spinach inconsistently or in large amounts can block the effects of warfarin, allowing clots to form and increasing the chance of a stroke. That's exactly what happened. George hadn't done anything wrong on purpose, but because his spinach intake varied from day to day, the level of vitamin K in his blood kept fluctuating. His medication couldn't keep up. It's like driving with a seatbelt that suddenly stops working when you need it most. And that's the danger. You don't feel it happening. Your blood pressure might seem normal. Your heart beats steady. But internally, your cardiovascular system becomes vulnerable. I've had patients suffer strokes or develop unexplained blood clots in their legs, completely unaware that their healthy eating habits were interfering with their medication. In George's case, we caught it in time. After adjusting both his medication and diet, he recovered. But many others don't get that chance. Sometimes, the first symptom is a sudden fall, slurred speech, or chest pain that comes out of nowhere. The danger isn't in spinach itself. It's in the inconsistency. If you're taking blood thinners, sudden changes in vitamin K intake from spinach, kale, or other greens can throw your treatment off balance. If you love spinach and your doctor approves, that's okay. But you need to eat it in steady, predictable amounts. Same portion, same frequency. Your medication can adapt if your habits are consistent. What it can't handle is unpredictability. I tell my patients all the time, the difference between a healing substance and a harmful one is often just the timing and the dose. Even the most natural food can become dangerous if it disrupts the fragile balance your body needs to maintain. So if even spinach, a food praised in every health article, can interfere with life-saving medication, imagine what else could be quietly causing harm on your plate? What if a seemingly harmless snack contains more sodium than a full bag of chips, slowly pushing your heart toward failure without you realizing? Let's move on to the next vegetable, one that's almost always sitting next to your sandwich. 2. Pickled cucumbers, a salty snack that slowly burdens the heart. Most people think of pickled cucumbers as a harmless addition to lunch, something tangy and crunchy that adds flavor to a meal. But for seniors, especially those managing high blood pressure or heart failure, this seemingly simple food may be doing quiet damage every single day. The main concern lies in its sodium content. Pickled vegetables are typically preserved using large amounts of salt, and even a few slices of pickled cucumber can deliver more sodium than you might expect. When sodium levels rise in your bloodstream, your body retains more water in order to dilute it. This leads to extra fluid in the blood vessels, forcing the heart to work harder, to pump that thicker volume. Over time, this increased pressure can strain the heart muscle, stiffen the arteries, and raise your risk of heart attacks, strokes, and kidney damage. Let me tell you about Maria, a 69-year-old woman who came in for what she described as mild swelling in her legs. She had been diagnosed with hypertension a few years earlier and was on medication, but her condition had seemed stable. During our conversation, I asked her to walk me through her diet. She mentioned how much she loved pickles and would often snack on them straight from the jar between meals. After some testing, we found that her sodium levels were elevated and her kidneys were beginning to struggle. The culprit wasn't just her main meals. It was the daily habit of snacking on high-sodium pickled cucumbers, which seemed innocent but added up to serious strain on her cardiovascular system. Many seniors are unaware that even small additions to their diet, if done frequently, can accumulate into real health risks. The effects are subtle at first, perhaps a little more fatigue after walking, a tighter feeling in the chest, or a bit of swelling around the ankles. But these are all signs that the heart is laboring against excess pressure, and unfortunately, the damage is often done silently. There's no sudden warning bell that tells you when your heart is nearing its limit. If you enjoy pickled foods, moderation is essential. Better yet, look for low-sodium alternatives or learn to make your own, using herbs and vinegar rather than salt. Always read nutrition labels carefully. A single serving might seem acceptable, but hidden sodium in small portions can stack up quickly over the course of a day. And if you've been told to follow a low-salt diet by your doctor, it's not just about avoiding chips or canned soups. It's also about paying attention to those small flavor enhancers that sneak into your routine and raise your risk without warning. Maria made adjustments. She switched to fresh cucumbers and began seasoning them with garlic and lemon instead. Within weeks, her swelling went down, her blood pressure stabilized, and she reported feeling more energetic. That's the power of making small but informed choices. And if one preserved snack can have that much impact on your heart, what about the vegetables that carry natural chemicals that may interfere with heart rhythm itself? Let's take a closer look at one you've likely had grilled. roasted, or turned into dip. 3. Red chili peppers. A beloved source of flavor may actually be placing your heart at serious risk. For many of us, the warmth of a spicy dish brings memories of family meals, cultural traditions, and the simple joy of food that excites the senses. A little heat feels comforting, whether it's hot sauce on breakfast, chili flakes on pasta, or a steaming bowl of spicy stew. The presence of red chili peppers feels familiar and satisfying, but for older adults, particularly those with a history of hypertension, heart disease, or irregular heartbeat, that fiery kick may be doing more harm than good. Chili peppers do more than just awaken your taste buds. They stimulate your sympathetic nervous system, the same part of your body that responds to threats or emergencies. This triggers a wave of adrenaline, causing your heart rate to increase, your blood vessels to narrow, and your blood pressure to rise sharply. In younger people with healthy arteries and responsive cardiovascular systems, this stress response is usually brief and manageable. But in someone over 60, with arteries that have lost flexibility and a heart more sensitive to pressure fluctuations, that short-term spike can set off something far more dangerous. Add common medications like beta blockers or blood pressure pills into the mix, and you have a situation where your body is pulled in opposing directions. The result can be erratic heart rhythms or even cardiovascular events. Let me give you an example. Dennis, age 74, once served as a firefighter. Tough, resilient, used to pushing through discomfort. He came to me complaining of sudden episodes of heart pounding that seemed to hit after dinner. He wasn't drinking coffee, wasn't under significant stress, but something didn't feel right. We reviewed his lifestyle, and one thing stood out. He had been enjoying spicy chili almost every night. I suggested he remove it from his diet for just 1 week. When he came back, he looked both surprised and relieved. His symptoms had vanished. That chili, which he had always viewed as harmless comfort food, had been quietly overactivating his sympathetic system, making his heart skip beats and race unpredictably. In people like Dennis, who may have underlying sensitivity in their cardiac rhythm, this repeated stimulation can tip the scales toward atrial fibrillation or worse, and it's not just the acute reactions that worry me. Chronic intake of spicy food may also lead to long-term low-grade inflammation in the blood vessels. Over time, that inflammation makes it easier for plaque to build up, for arteries to stiffen, and for blood flow to become more turbulent. All of this adds pressure to an aging heart, already working harder to keep up. Many people don't realize that their digestive symptoms can also mask cardiac issues. Spicy food can worsen acid reflux, a condition common in seniors, and that discomfort in the chest can feel eerily similar to heart-related pain. I've seen many older patients rush to the ER believing they were having a heart attack, only to discover it was food-induced reflux. But sometimes, unfortunately, it is the heart, and the signs get missed until it's too late. Dennis now cooks with herbs like basil and thyme, with lemon and cooked garlic instead of raw chili. He still enjoys flavorful food, but with a more thoughtful approach. Since making that change, he hasn't experienced a single flutter. That decision may very well have prevented a serious event. So, if your blood pressure remains high despite treatment, If your chest feels strange after meals, or your heart beats unevenly when you're trying to sleep, it may be time to reconsider your relationship with spice. Your heart may be sending warnings in subtle ways, and if red chili peppers, which many assume to be natural and harmless, can create zooch disturbances, what about ingredients promoted for heart health that people misuse without guidance? Next, let's take a closer look at raw garlic. You may think of it as a daily remedy, but taken the wrong way. It could be silently hurting the very organ you're trying to protect. Let's continue with point number 4. 4. Raw garlic, the natural remedy many seniors trust, could be putting your heart in harm's way. Garlic has long been praised for its medicinal benefits. From lowering cholesterol to thinning the blood, it is often recommended in natural health circles and even by some doctors as a supportive supplement. But when it comes to raw garlic, especially when swallowed whole, like a vitamin, there's a very real and rarely discussed danger. While garlic contains compounds that may reduce clotting and improve circulation, consuming it raw, concentrated, and in large amounts can be risky for those with heart conditions or fragile blood vessels. Many older adults believe that swallowing raw cloves will prevent strokes or heart attacks, but they don't realize they may be making their blood too thin or irritating the stomach lining, triggering digestive distress that can easily be mistaken for cardiac symptoms. I once treated a man in his 70s who was admitted to the hospital with unexplained dizziness, fatigue, and low blood pressure. He wasn't on any prescription blood thinners. His tests didn't show infection or internal bleeding. It wasn't until we asked about supplements that he revealed his daily habit of swallowing 2 raw garlic cloves with water each morning. That was the only change he had made in the weeks prior. We asked him to stop immediately, and within days, his symptoms improved. What he had done, unknowingly, was create a condition where his blood pressure dropped too low and his clotting time increased, raising his risk for both fainting and internal bleeding. Garlic, in moderation and when cooked, can support health. But raw garlic, especially when used like medicine without oversight, can overwhelm the body's regulatory systems. For those already on anticoagulants or blood pressure medications, this creates a dangerous overlap, and the effects are not always immediate. Raw garlic can slowly erode the lining of the stomach, increasing the chance of gastritis or ulcers. That damage can produce symptoms like chest pain, nausea, or lightheadedness, which might be confused with angina or even heart failure. It's not uncommon for seniors to show up in emergency rooms clutching their chest, convinced of a heart attack, only to find that the real culprit was their morning garlic ritual. In some cases, the irritation becomes so severe that it triggers stress on the vagus nerve, disrupting heart rhythm and leading to palpitations. Garlic may seem harmless because it is natural, but so is gravity, and we don't jump from rooftops without consequence. The truth is, even natural substances require understanding, context, and moderation. I advise all my patients to treat raw garlic with respect. If you enjoy garlic, use it cooked in meals. Avoid swallowing it raw unless specifically instructed by a healthcare provider who understands your full medical history. And never assume that more is better. In health, the right dose makes the difference between benefit and harm. If you are taking medications, managing heart disease, or recovering from a stroke, talk to your doctor before adding strong herbal practices to your routine. What works for one body can burden another. Raw garlic might seem like a small choice, but when combined with age-related changes in digestion, circulation, and medication metabolism, it can become a silent threat. And if this natural remedy carries hidden danger when misused, imagine what could happen when something even more acidic enters the picture. Up next, we need to talk about grapefruit juice and how it can silently interfere with your medications in ways that might shock you. If you've ever been told to avoid grapefruit while on certain prescriptions, what you'll learn next will help you understand why. Let's continue with point number 5. 5. Raw sprouts. The seemingly innocent greens added to your salad could be placing your aging heart in a vulnerable position. On the surface, raw sprouts like mung, alfalfa, and bean look pure and vibrant, a symbol of fresh, healthy living. They are often featured in health-conscious meals and recommended in wellness circles as a clean, nutrient-dense option. Many seniors choose them with the best intentions, aiming to improve their diets and boost vitality through natural foods. However, what most older adults do not realize is that these raw sprouts carry a risk that can far outweigh their nutritional value, especially in bodies already facing age-related decline. The core problem lies not in the sprouts themselves, but in the environment where they grow. These delicate greens are sprouted in moist, warm conditions that also happen to be ideal breeding grounds for dangerous bacteria like E. coli, Listeria, and Salmonella. While a younger immune system might fight off these pathogens with ease, as a senior's immune defenses are no longer as robust. What starts as a minor digestive upset in someone young can turn into a full-body emergency for someone over 65. Let me tell you about Ruth, a 76-year-old former nurse who made careful, health-conscious food choices every day. Her diet was low in salt, free of processed snacks, and full of leafy greens. She believed she was doing everything right. One weekend, she attended a community lunch where she ate a homemade sprout salad. Just 2 days later, she began to feel ill with symptoms of fever, fatigue, and severe diarrhea. When she came to my clinic, she was already dehydrated and breathing with difficulty. Testing revealed she had developed Listeria sepsis, a bloodstream infection caused by contaminated food, but the situation escalated quickly. The bacteria had reached her heart and caused endocarditis, an infection of the inner lining of her heart chambers and valves. Her heart rhythm became irregular. Her blood pressure dropped to unstable levels. The infection had weakened her heart to the point of collapse. With intensive hospital care and weeks of intravenous antibiotics, Ruth survived. But she lost more than just time and recovery. Her heart never fully regained its strength. She needed help with basic activities and eventually had to move in with her daughter. She didn't suffer because she was reckless. She got sick trying to eat better. That's what makes this so devastating. According to data from the CDC, older adults are among the most vulnerable populations when it comes to raw sprouts. These greens are rarely cooked, which means any bacteria they contain is ingested directly, and rinsing them is not enough. Contamination often starts inside the seed itself, far beyond the reach of household cleaning. Symptoms don't always appear immediately. By the time an older adult feels sick, the infection may already be circulating through their bloodstream and reaching critical organs. For anyone taking heart medications or managing cardiovascular disease, that internal stress becomes too much to bear. Your heart relies on balance, on steady blood flow, and regulated rhythm. When it's forced to divert energy toward fighting off a bacterial invasion, it can no longer maintain that stability. The result might be an erratic heartbeat, severe fatigue, or even a heart attack. So what should you do? If you like the texture of sprouts, consider lightly steaming or sautéing them to destroy harmful microbes. Or try using other foods with similar crunch and freshness, like avocado, roasted red peppers, or cooked greens. You can still enjoy variety and nutrition without exposing your body to unpredictable pathogens. Ruth's story is not about fear. It's about awareness. She thought she was making a safe choice. Now she is more cautious, and she asks questions about every ingredient. She still eats with care and purpose, but she never assumes raw equals safe. The lesson here is simple. The foods we once tolerated in youth may carry very different consequences in older age. What helped you thrive before might now be asking too much of your immune system. If something as tiny as a sprout can cause such destruction, what happens when we introduce vegetables that interact directly with our medications? Up next, we will examine a common vegetable that appears perfectly healthy but can quietly interfere with the very drugs that are protecting your heart. 6. When vegetables and medications quietly clash, they can create a dangerous ripple effect within your body without you even realizing it. For most of your life, eating vegetables has been a symbol of good health. From childhood to adulthood, they have been championed as vital, wholesome, and safe. But as you grow older and start taking medications to manage heart disease, high blood pressure, or other age-related conditions, the relationship between food and medicine changes dramatically. Many older adults find themselves confused and frustrated, wondering why their heart health isn't improving despite their best efforts. What they may not realize is that their medication may be working against certain nutrients in their food, and vice versa. These silent conflicts, known as food-drug interactions, can compromise the effectiveness of your prescriptions or even lead to new health complications. Several classes of heart medications are particularly sensitive, including blood thinners, beta blockers, diuretics, and ACE inhibitors. These medications operate with precise biochemical targets. When you consume certain vegetables, they can either block the medication's action, intensify its effects, or cause it to remain in your system longer than intended. Grapefruit is a notable example, and although it's a fruit, the issue it presents is relevant. It contains chemicals that interfere with the enzymes in your liver responsible for metabolizing drugs. This interference can lead to toxic drug buildup or, on the other end, render the medication ineffective. Symptoms can range from fatigue and dizziness to arrhythmias and muscle pain. Now let's consider cruciferous vegetables like kale, Brussels sprouts, and broccoli. While these are rich in nutrients and often viewed as superfoods, they also contain high levels of vitamin K. For patients on blood thinners such as warfarin, a sudden increase in vitamin K can reduce the blood thinning effect, leading to clot formation. I remember Harold, a 79-year-old veteran who added generous servings of kale to his nightly dinners after his stroke. Unaware of the interaction, he came into my office weeks later, showing early signs of a transient ischemic attack. A simple adjustment in his vegetable intake and medication dose stabilized him, but it was a close call. Then we have potassium levels to consider. If you are taking diuretics, you might be flushing potassium from your body, which can lead to fatigue, palpitations, or even collapse. But if you are on a potassium-sparing diuretic and you consume too many potassium-rich foods like beets, avocados, or potatoes, you might push your levels too high, risking irregular heart rhythms or cardiac arrest. This delicate balance requires close attention. What makes all of this more concerning is that these interactions don't send out loud warning signs. There's no sudden pain or rash to alert you. Instead, your health deteriorates gradually, sometimes unnoticed, until something critical happens. The takeaway isn't to eliminate vegetables from your diet, but to treat them with the same respect you give your medication. Always speak with your doctor before making major dietary changes. If you're adding more greens, increasing cruciferous vegetables, or consuming more potassium-rich items, a simple blood test can confirm whether your medication still fits your nutritional profile. Grapefruit, in particular, should be avoided unless your physician specifically allows it. And keep an eye on how you feel after meals. Don't assume that natural means harmless. Harold now enjoys kale twice per week rather than daily. And with regular monitoring, his heart has remained stable. He serves as a clear example that informed choices can prevent dangerous mistakes. But sometimes the issue isn't interaction. Sometimes a vegetable that seems plain and harmless can, over time, cause low-level inflammation that quietly damages the arteries. That's exactly what we need to explore next. Let's take a closer look at eggplant and its surprisingly complex relationship with your heart's long-term health. If you found this discussion helpful, leave a comment with the number 1. Now, let's move forward to point number 7. 7. Eggplant. The mild vegetable that might slowly stir up harm inside your arteries without making a sound. For many older adults, eggplant is a regular part of the diet, often enjoyed grilled, baked, or blended into comfort foods that bring back memories of home. It seems soft, harmless, even bland. But beneath that silky texture lies a compound that deserves more attention. As we age, eggplant belongs to a group of plants called nightshades, which also includes tomatoes, bell peppers, and white potatoes. These vegetables contain naturally occurring chemicals called alkaloids, and in eggplant, one of the most prominent is solanine. In small amounts, alkaloids are usually tolerated by the body, but in people over 60, especially those with cardiovascular issues or chronic inflammation, repeated exposure can build up stress in the lining of the blood vessels. You may not notice anything at first. There's no rash, no immediate upset. But inside your arteries, especially those already narrowed or stiffened by age, low-grade inflammation can quietly progress over time. This inflammation makes it easier for plaque to break off, encourages clot formation, and pushes the heart to work harder with each beat. I remember a woman named Margaret, age 72, who came to me complaining of fatigue, stiffness, and a general sense of heaviness in her chest that routine tests couldn't explain. She had no recent infections, Her medications were stable, and yet her inflammatory markers were elevated. After carefully reviewing her food diary, I noticed that she was eating eggplant 4 to 5 times a week, often in stews or roasted dishes. I asked her to pause all nightshades for a month. Just 1 month. When she returned, her blood tests had improved. Her symptoms were lighter, and she said something I won't forget, doctor. I didn't realize food could make my heart feel tired. That phrase struck me. A tired heart is a vulnerable heart. For seniors, that feeling of heaviness, of unexplained pressure, could be a sign that inflammation is building from the inside. The problem isn't eggplant itself, but rather the frequency and the underlying condition of the person eating it. Some people tolerate nightshades well, others don't. And unfortunately, the reaction isn't always obvious until damage has been done. If you've had previous cardiovascular issues, auto-immune condition, or chronic joint pain, nightshades may contribute to your body's inflammatory load. That's something your younger self might have handled without issue, but your older self may not. So, what can you do? First, track how often you're eating nightshades, especially eggplant. Then, try eliminating them for a few weeks while noting how your body feels. It's not a punishment. It's an experiment to see whether your energy improves, whether your blood pressure settles, whether the sense of tightness or fatigue begins to lift. And if eggplant isn't a problem for you, that's fine. But if it is, you now know. Knowledge is power, and it gives you choices. Margaret still enjoys many of the same recipes, but now she substitutes zucchini or mushrooms in place of eggplant. Her heart is doing better. And more importantly, she feels more in control of her health. So ask yourself, could a food you've always thought was gentle be quietly straining your heart? And if that's the case with something as common as eggplant, what happens when we move to foods that disguise themselves as healthy but may carry hidden threats, depending on how they're grown, stored, or eaten? Up next, we need to talk about a popular vegetable that many believe is safe in every form. But when improperly stored or prepared, may expose your aging heart to toxins your body can no longer process as easily. If you found this helpful so far, drop a number 1 in the comments. Now let's continue with point number 8. 8. Raw cabbage. The crunchy vegetable that may be silently throwing your heartbeat off track. Cabbage has long carried the reputation of being one of the healthiest choices in any meal. It's low in calories, rich in fiber, and often added raw to salads, slaws, or wraps. For younger adults, that reputation usually holds true. But once you pass 60, the story can shift, especially if you're living with high blood pressure, irregular heart rhythms, or digestive sensitivities. Raw cabbage could be doing more harm than good. You see, cabbage is high in insoluble fiber, which is much harder for aging digestive systems to break down. Unlike soluble fiber that blends with water and supports cholesterol balance, insoluble fiber can cause bloating, gas, and abdominal discomfort, particularly when eaten raw. In older adults with reduced stomach acid, slower gut movement, or a history of reflux, These effects can be more than uncomfortable. They can be alarming. That trapped gas and pressure doesn't just stay in the stomach, it pushes upward against the diaphragm, crowding the chest and placing subtle stress on the heart. In some cases, it even interferes with the vagus nerve, which helps regulate heart rate. I've had several patients come to me fearing they were having heart attacks, only for us to discover the culprit was a large serving of raw cabbage. One case that stands out is Eileen, a 73-year-old retired school teacher, bright, lively, and independent. She began noticing odd flutters in her chest most evenings. Her heart would skip beats or suddenly speed up after dinner. Her tests showed only minor atrial irregularities. Her lifestyle was healthy, but one detail caught my attention. She had recently developed a habit of eating coleslaw every evening, nearly 2 cups at a time. Eileen believed it was helping her digestion, but in reality, the fermentation and gas from all that raw cabbage were irritating her vagus nerve and creating internal pressure that triggered her palpitations. She wasn't in immediate danger, but her body responded with real anxiety, real breathlessness, and real fear. These aren't just harmless digestive side effects. For older adults, any shift in heart rhythm is a serious matter, especially when it's being triggered by something as avoidable as diet. And there's another layer to consider. Raw cabbage contains substances known as goitrogens, which can interfere with how your body absorbs iodine. This can affect thyroid function, especially for seniors already on thyroid medication. As metabolism slows, blood pressure can become unstable, energy drops, and subtle cardiac strain follows. The simple fix is cooking. Lightly steaming or sautéing cabbage softens its fibers, reduces gas formation, and neutralizes most of the compounds that cause problems. That's exactly what Eileen did. She made the switch, and within 2 weeks, her symptoms vanished, her heart steadied, her sleep improved, and her peace of mind returned. She told me something powerful. I thought I was doing everything right. I didn't realize food could hurt me now. And that's a truth many seniors need to hear. Your body at 70 is not the same as it was at 40. The rules have changed. What once helped may now hinder. And it's not your fault. You're still making good choices. You just need updated guidance. But raw cabbage isn't the only salad bar staple that carries hidden risks. There's another vegetable that hides in plain sight, crisp, sharp, and flavorful, but capable of sending shockwaves through your heart and digestive system if not handled properly. Up next, we'll explore raw onions and why that bold flavor may be leaving a deeper impact on your aging heart than anyone has told you. If you're still following and learning something new, leave a number 1 in the comments below so I know you're with me. Now, let's move forward to point number 9. 9. Raw onions, the sharp-tasting vegetable that may be stirring up hidden trouble inside your heart. Onions are found in nearly every kitchen, sliced into salads, layered on sandwiches, or chopped into salsas. Their crunch and bite are celebrated for adding freshness to a dish. And many believe they carry natural health benefits, but for older adults, especially those with sensitive digestive systems, arrhythmias, or high blood pressure, raw onions may be triggering symptoms that feel like heart trouble but go undetected until it's too late. Let's start with digestion. Raw onions contain a high amount of fructans, a type of carbohydrate that ferments in the gut and creates gas in people under 40 that may just lead to mild discomfort. But after tres, your ability to break down these compounds decreases significantly. This means more fermentation, more bloating, and more upward pressure against the diaphragm and chest wall. This internal pressure doesn't just cause discomfort, it can also interfere with the vagus nerve, the critical pathway that helps regulate your heartbeat. I remember a patient, a 7-8-year-old man named Carl, who came in after 3 nights of chest tightness and skipped heartbeats. His vitals were mostly stable. His heart showed mild atrial fibrillation. He didn't smoke. He didn't drink. He was on stable blood pressure medication. But as we went through his meals, one thing stood out. He had been eating raw onions every day in his salads. When I asked why, he said he heard onions were good for circulation. And in some ways, that's true. Cooked onions contain antioxidants and may support vascular health. But raw onions are a different story for an aging body. The sulfur compounds that give onions their sharp bite can irritate the stomach lining, stimulate acid reflux, and contribute to uncomfortable pressure that mimics heart symptoms. In Carl's case, that pressure, combined with his existing heart sensitivity, was enough to throw off his rhythm. We asked him to eliminate raw onions from his meals for 2 weeks. When he returned, the symptoms were gone. No palpitations, no fluttering, and for the first time in months, he was sleeping through the night without worry. Onions also have blood-thinning effects, which may seem helpful until you consider that many seniors are already on medications for thinning blood or managing clotting risk. Adding raw onions into that mix, especially in high amounts, can amplify the effects of medications like aspirin or warfarin, making bruising and bleeding more likely. And just like with cabbage, the digestive discomfort from raw onions can trigger anxiety or panic in older adults, leading them to mistake gas and reflux for something more dangerous, like a heart attack. For those with a history of cardiac events, that confusion can be traumatic. The solution is simple. Cook your onions. Roasting, grilling, or lightly sautéing them can preserve their flavor while reducing their harsh digestive impact. You still get the benefits without the side effects. Or better yet, replace them with heart-friendly options like steamed leeks or cooked shallots. Carl now enjoys his salads with grilled vegetables and says he feels better than he has in years. His story is a reminder that even something as small as a raw onion can tip the balance in a body already working harder with age. And if raw onions can do this, imagine the impact of combining multiple foods that all carry their own risks. It's not just about one vegetable. It's about understanding how all your choices work together, especially after 60. But before we finish, there's one more lesson that ties everything together. A final thought about how to eat wisely, live confidently, and protect your heart without giving up the joy of food. In the next section, we'll bring it all home and talk about how you can take control of your health. Starting today, if this video has helped you see food differently, comment the number 1 so I know you're still watching. Let's wrap it all up with a clear path forward.